Can you tell us about a time when you had conflicting priorities and how you handled the situation?
Ooh, that's a good one.
I feel like that's an easy like delegation one.
Yeah, that is. Let's see. I know I had something like that happen today, actually. So today, for example, at work, I do infusions at work, but before my infusion patients get there, I'll just help out in the back office doing other tasks. And I had a patient come in that was a little bit of a longer appointment because it was an oral food challenge, so it's over an hour long. And this was a younger patient, so it can take even longer. And I knew it was gonna get into the time frame of my infusion patient. So I started the oral food challenge appointment, and then when my other patient got there, I had to find someone who could take over for me for the oral food challenge, which we don't normally like passing those on just because you have to kind of know what the patient's baseline was, like their skin assessment, if they had like a rash already, so you know what to look out for if they are having a reaction to the food. So I had written some notes down already from their baseline and had the dad take a picture of the patient's face. And I also let him know that I might be switching with another nurse, so he wasn't just thrown the idea that I wouldn't be with them. And I told him from the very beginning that I had another patient coming in and I would probably be having another nurse take over, but that I would let him know before that happened. So when my other patient got there, I introduced the dad and the patient to the other nurse covering for me. And I gave her my notes too, which luckily he had clear skin, so I didn't have to really like show her anything, but I did give her my notes just in case and let her know that dad took a picture of his face too. So I had to delegate so I could get the other patient taken care of.
Perfect.
I had two tasks to get done, which both were a priority. And I had to obviously choose which one I was going to do first. And there really was no right answer. It just came down to how I decided to move about the tasks. And so what I did is I had two patients that were due for blood sugar readings. And I decided to approach the task by completing the one that was going to be done fastest in the shorter amount of time first. And I decided this by thinking about which patient I could do that quickest to. And one patient was an easier blood draw. The other one I knew it always took multiple pokes and it was really hard to just get the blood out of the finger. And I decided to do the other patient first. And that just allowed me to not allow one task to set me back from the rest of the tasks I had to get done.